Hello, my name is Amanda Schwarting, and I am presenting the ethical debate for the affirmation of marijuana for medical use. I am one of four in my wonderful group. I'm joined by Courtney, Elizabeth, and Helen. I'm going to start with question A. What is the problem issue, and what is the background on it? Well, the problem is that there are so many people suffering that don't have to be because of the treatment that marijuana can effectively give to people for their different symptoms. But it started a long time ago. Marijuana was actually sold in the United States until about 1937, where there was the Marijuana Tax Act was passed related to the prohibition and taxation of it. In 1951, Congress classified it as a narcotic, and then in 1970, it was considered a controlled substance. The legality of marijuana limits many researches that could be conducted to help alleviate some of the symptoms that marijuana could treat effectively. It's historically been practiced. It's used in religions throughout time for different things such as constipation, many different kinds of pain, depression, insomnia, vomiting, anorexia. The list goes on and on for the number of symptoms that it can alleviate. Question B, why is this problem significant? The problem is significant because many people think that obviously there are people out there in pain or discomfort or have these symptoms that don't need to be. And there's a feeling that Congress is getting too involved in our medical treatment. Senator Ted O'Brien from New York says that we can tweak a bill, but there can't be a perfect bill. People are suffering right now, and that suffering can be alleviated as soon as we make them available to the patient. And that medical marijuana should be an important, affordable treatment for all patients nationwide. The American Cancer Society supports the need for more research on this drug. They like its many different contributing factors, and they like the way that it helps the patients with the study so far, but they just feel like more research needs to be done. Ultimately, they feel like medical decisions about pain and other symptoms should be made between the patient and the physician, as opposed to the physician and the government. It should be based on the patient's priorities, affordability, their religious background, their families, their culture, and that decision needs to be made between a patient and a physician, and the physician needs to put the patient first and think about what medication would best treat their symptoms. So there's an obvious disconnect between federal agencies and the healthcare communities about the value of marijuana. Question C. Include the American Nurses Association Code of Ethics for nurses to support your argument. The evidence demonstrates a connection between therapeutic use of medical marijuana and symptom relief. The American Nurses Association actively supports patients' rights to legally and safely utilize marijuana. The American Nurses Association supports 5 different things. First thing is the education of registered nurses and other healthcare practitioners regarding appropriate evidence-based therapies for marijuana. Also, the non-smoking forms, which are TLC and some forms of like Marinol. 2, the protection from criminal or civil penalties for patients using medical marijuana as permitted under state and federal laws. 3, exemption from criminal prosecution, civil liability, or professional persecution, such as loss of license or accreditation from healthcare practitioners who prescribe, dispense, or administer medical marijuana according to their state law. 4, reclassification of marijuana status from a scheduled controlled substance to a less restrictive category. And 5, confirmation of a therapeutic efficiency of medical marijuana. So the American Nurses Association has obviously conducted their own studies, and they feel that it's appropriate for the patients if that's the best treatment for them. Question D, prior efforts to solve this problem. Prior efforts to solve the problem. I think when I think of this question, I think of prior efforts to solve like chronic pain, or prior efforts to solve many symptoms that can be affected by like AIDS and chemo and things like that. When I think about the number one reason that medical marijuana is out there, it's for pain, all types of pain. And when using, you could say, traditional medications for this, you come up with so many different types of narcotics or different medicines for so many different kinds of pain, as opposed to one medical marijuana that helps to alleviate basically universal pain. These different pain medications, there's different dosages. You can build a tolerance to them, and also extreme side effects come with these medications. So you may not have pain, but you could be nauseous, constipated. You might not eat. You might get addicted to them. There's so many other side effects that go along with them. It makes it not even worth it to take them, basically. And there's also like an extreme dependence that's built around these narcotics. The Institute of Medicine determined that compared to other drugs, both legal and illegal, like alcohol, tobacco, cocaine, dependence for marijuana was extremely rare, and if any, was much less than even legal drugs like tobacco and alcohol. So there's obviously, an important factor that goes into it, and it can solve all these problems by basically one medication. One medication can solve so many different ailments. So that was my presentation for the first half, and now my partner, one of my team members, is going to present the second half of the presentation.